Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome Dr. Arnold Pallay, who received his medical degree from Boston University School of Medicine and has been in private and academic practice for more than 30 years. Dr. Pallay practices family medicine and genetics in Montville, New Jersey, and is affiliated with multiple hospitals in the Northeast. He is the founder and associate medical director of the genomics program at Atlantic Health. Dr. Pallay has advanced training in genetics and genomics and is a frequent lecturer locally and nationally to both physicians and the lay public. He is an appointed member of the Commission on Education of the American Academy of Family Physicians and is a teaching clinical faculty member at a number of New Jersey, New York, and Pennsylvania medical schools, including Rutgers, Thomas Jefferson, and Touro Medical Schools. Dr. Pallay's practice participates in genetic research, including serving recently in a 13-site National Genetics Consortium studying children with genetic disorders that was sponsored by the American Academy of Pediatrics. He has been involved in research protocols to determine if precise genetic testing can alter the care received by medical and mental health patients by choosing to use or avoid certain medications. Dr. Pallay, welcome to The Therapy Show.
Thank you, Bridget. I'm so happy to be on your podcast show and delighted to enlighten the public about the world of genetics, pharmacogenetics, particularly as applied to the mental health discipline.
So can you start by telling us a little bit about your personal background and professional development that led to your research in the field of pharmacogenetic testing?
Well, yes, Bridget. In fact, it's kind of an interesting, quick story. As a family physician, I delivered babies for 20 years in my practice in the greater metropolitan area, New York City, actually in New Jersey. When I stopped practicing the obstetric portion, I had extensive background and training in genetics. I continued that, and one of my major teaching hospitals, the Morris County area, asked me to start a program in genetics. I subsequently did fellowship level training at a number of the leading genetics centers throughout the country, including Scripps Clinic, Harvard, Cleveland Clinic, and Duke, to gain knowledge and awareness, the burgeoning and developing area of genetics. That led to the development of knowledge and training in pharmacogenetics, something we'll talk about throughout this podcast, which really looks at how medications and genes interact with each other. And it's an important area and a piece of the puzzle that we as physicians and other mental health practitioners can use to help out patients.
So how would you briefly explain pharmacogenetic testing to a non-professional?
So what pharmacogenetic testing does, it looks at genes by taking either a blood sample or a buccal swab, that is a cheek sample inside the mouth, to send off gene analysis. And we test anywhere from 24 genes, in some cases up to hundreds of genes, to analyze what kind of genes an individual has. Based upon that, and based upon knowing what medications they either are taking, have taken in the past, or are going to take in the future, we can determine how an individual personally will respond to medications from both a pharmacodynamic and a pharmacokinetic standpoint, which means how the drug is metabolized and how we as a person handle that drug inherently.
Would someone diagnosed with a mental disorder who is prescribed psychiatric medications by their doctor be a candidate for this type of genetic testing?
Well, absolutely. Not in all cases. And I'm not suggesting we all have to get pharmacogenetic testing, but we are finding it can be invaluable in our patients. And I provide them both for patients I see when appropriate and upon referral from mental health providers and psychiatrists who are having difficult cases of their patients who may not respond, for example, to a number of antidepressants or other mood stabilizing medications, or individuals who perhaps need a higher dose or a lower dose of that particular medication. Let me take a minute to digress and give you the best example I can give you. Codeine has been used as a cough suppressant for many years. If you prescribe codeine to two different 5-year-old children who play with one another at the same dose, but they each metabolize or handle the codeine differently. One may get the proper relief of their cough and may do well. The other child may respond completely differently. In fact, could metabolize the codeine poorly, which could lead to suppression in the brain function of respiration, and even could die from that use of codeine at the same dose with the same body weight, the same gender, etc., as their little friend. I think that makes the point that we all respond differently to medications, particularly psychiatric medicines, based on factors beyond height, weight, and gender, that genetics plays a key role in how we use medications.
Why is it important for doctors prescribing psychiatric medications to do a complete family history as well as genetic testing prior to making their treatment recommendations?
Well, I think what is becoming more and more state of the art is that by having a complete family history, particularly I like to do a 3-generational family history, there is a certain element of genetics within mental health particularly. So if there's schizophrenia, depression, anxiety conditions, it's not uncommon to permeate 1, 2, or 3 generations, and all psychiatrists and mental health providers have tended to take that history to find out more about that. But now we have, I call it a fourth piece of the armamentarium, which is genetic testing, which can be made available so we can see whether a certain individual might respond better, for example, to sertraline, which is a well-known antidepressant. And if they have good genetics for that medication, it might be a good starting point. Or perhaps more commonly, if they've already been prescribed certain medications that are commonly used for a number of different conditions like anxiety, like ADD, etc., by knowing one's genetics, if there's a difficulty of using these medications, it helps the practitioner to understand what might be the best options or what may not be a good option for that specific individual.
So how often are these tests ordered by psychiatrists, other mental health clinicians, and primary care physicians?
So this is something that's becoming a little more cutting edge over the last few years now. Centers such as ours have been doing studies on this to determine the value, the validity, how helpful it is for the practitioners. And what I would say is we're finding that as more psychiatrists are aware of it and more are using the test, which is a somewhat small number currently, a number of mental health providers have been made aware of it. And I have many patients who come to my center or other centers to do the test. So again, it has proved to be valuable. Primary care physicians have also been made aware, and this type of testing can often help in non-mental health areas, such as the use of blood pressure medications, lipid metabolism medications, thyroid, and absolutely are invaluable in pain management therapy. We can pinpoint how people's gene-drug reactions help us to know who will respond better to medication X, Y, or Z based upon their genetics. Now, if I can return back to the mental health area, this can be particularly important that as the price has dropped for these testings, as their availability has become more noted throughout the country, there is more usage. But again, I want to caution our listeners, I'm not suggesting each and every patient needs this test. It is particularly valuable in complex patients who are on poly drugs or are taking many medications based upon drug reactions. It's helpful for individuals who have failed 2, 3, or 4 modalities that have been provided already. And it can be helpful, some cases, for new starts, particularly when we have other family members who may or may have not responded well to a particular medication. Bridget.
So, Dr. Pallay, which psychiatric conditions are eligible for genetic testing?
Well, I'm glad you asked that because it turns out it's a good number of conditions. And certainly most categories of antidepressants, SSRIs, SNRIs are able to be tested. Antipsychotics, mood stabilizers. We even check for MTHFR, which is a folate metabolism system as well. So it's surprising a whole host of psychiatric conditions can have valuable input from pharmacogenetic testing, which can help us as practicing clinicians or as genetic consultants to advise our mental health consultants how to best use these medications. Listen, I don't want to give the wrong idea to our listeners that this is a perfect answer. I have had experience with people who've had genetic testing, pharmacogenetics, sometimes we call that PGX, and it has looked like from my genetics, they may not be the best candidate for a certain type of, let's say, MAO inhibitor psychiatric medication, but they have reported to me and to their psychiatrist, they have done wonderfully well on such a medication. I would not suggest changing them off that medication if the clinical experience has been positive. But what I would absolutely recommend, and I've had many, many examples where we have used this information to alter or tweak the medications prescribed with excellent results for the patient and their prescriber.
So how reliable are these tests?
Well, it's interesting. The reliability is changing daily because as more tests are performed, the many companies that provide pharmacogenetic testing are very, very carefully analyzing, as are research centers, what is the value, what is the validity, what is the cost effectiveness of these tests. The statistics are hard to come by because it's very anecdotal how people respond. It's very difficult to do a double-blinded study on individuals on depression, for example, or other mood destabilization conditions to know one medication versus the other and based on genetic testing. But we have been working on population health studies in our particular institution, and there are others around the country trying to arrive at that. I think I can say that as more tests are done, as data is provided and analyzed, we're going to find that they are helpful, reliable, but like most tests, they're not perfect. And there will be those examples, as I stated previously, of people who may metabolize slowly or rapidly that it may impact upon. Let me take this moment to make that point. Sometimes this is particularly helpful that if someone is a rapid metabolizer based on their gene analysis, it may suggest they need a higher dose than the norm, and the reverse is true if they're a slow metabolizer. So these tests don't just pinpoint what medication, but can also point us in the direction of proper dosing. I always use the example of statin drugs for cholesterol reduction. These medications, if someone has a gene finding from pharmacogenetic testing, I will usually up the dose much more rapidly if the gene testing suggests they are rapid metabolizer as opposed to their friend who may be a slow metabolizer and may need a lower dose.
So what are the most common obstacles that prevent patients from taking advantage of pharmacogenetic testing?
Well, first of all, the world of genetics is rather complicated. The test results reporting can be complex for both patients, psychiatrists, mental health providers, and primary care physicians to interpret. There's a lot of work on trying to make these results more easily quantifiable and easier to understand. Many of the practitioners don't know these tests exist, which is, of course, a problem as well. The cost has become less of an issue of late as I have found more coverage from insurance companies because they recognize that if we can arrive at the proper medication regimen for a complex patient on 4 or 5 mental health provided medications, it will save thousands and thousands of dollars in misprescribing, so to speak, if you understand that. So I think as cost has dropped because of availability and as patients are more aware and their providers will arrive at a steady state to determine who are the right individuals. Once again, I don't think it's necessary for all patients. And I, by no means do I do this on even a high percentage of my individuals if we're starting them on medications for anxiety, simple depression, ADD. But these individuals, when they don't respond easily or they have failed other medications, these are the best cohort of patients who will be wonderful individuals to use pharmacogenetic testing.
Can you share any poignant examples of where pharmacogenetic testing for psychiatric medications had a major impact in someone's life?
I have many, many examples where people have been referred to me, like I said before, who have had poor responses to a cornucopia of medications. And I have used the pharmacogenetic testing to provide advice and support for these individuals, particularly back to their other mental health providers if I'm not doing that. And I have made recommendations of a different class of antidepressants, once again, might be a good example. And they have now been able to provide the right dose and the right medications. And it's just a number of examples. And I've had people, email me, call me, thank me for the ability to arrive at a better prescribed medication regimen because of the use of these medications. It doesn't happen every time. It's not 100% because we as individuals have complicating parts of our lives, how we eat, how we exercise, our family dynamics, etc. Genes are one of the cornerstones of how we function, but it's a key element. And so, yes, it has been very valuable in a number of individuals.
So what are you most excited about in mental health treatment today as it relates to pharmacogenetic testing?
Well, again, it's really a tremendously important piece of the puzzle as we have multiple new modalities. We have SSRIs, which work on serotonin parts of the blood system. We have dopamine agonists. We have a number of different medications for a number of mental health conditions, new medications released. We have electric convulsive therapy options that are out there as well. With all these various options available to our patients, by having a genetic knowledge of this patient, we can arrive at more precise and precision or laser focused therapies. So I am excited to see as my mental health comrades and colleagues work with the genetic industry that I'm involved in, that we together can arrive at better therapy options. But again, I want to emphasize, we cannot take out the element of people's situational environment and people's other background that are a key parcel to mental health. It's not exactly the same as treating lipid management or blood pressure, where it's a little more focused. Mental health has so many components. I think that if I was a mental health provider alone, having this is just another piece of my therapy options that can help me to arrive at better options. And as more studies are released and more knowledge is made available, we will be able to use this as we choose which piece of therapy works best for our individual patients. Everyone is different. We all have different makeup, different backgrounds, and this is a piece that will help us.
So if you had a magic wand and could improve one thing about mental health treatment today, what would that be?
Well, better availability, number one. As you know, we're in a difficult world today with the pandemic going on. People are having difficulties in social interactions. We need more available, different modalities, including telehealth options for our mental health people. We need to have better insurance coverage so people can get mental health. And as a piece of that, I think pharmacogenetic testing is just another piece of that I think we need to get laser focused on proper diagnosing, proper therapy, and proper ways to handle patients, which include not just medication, it's psychotherapy, it's other alternatives, it's in-home options, etc. So my hope is that pharmacogenetics can be another piece of the puzzle that can be available, affordable, and make patients comfortable with their therapy.
I completely agree. So how can my audience learn more about your work, either online or in print?
Well, I do a good deal of blogging and I do a good deal of putting my lectures online. We work at the Atlantic Health System in Morristown and Overlook Hospital in New Jersey, my private practice in Montville as well. We try to do a lot of this work. But I think one of the best ways to know more about this is people can review a number of the pharmacogenetic companies. And while they are obviously proffering their product, we understand that, a lot of them have a wealth of information to read. So if you were to Google or search in Bing for pharmacogenetics, you can find a wealth of information, some of which I have been obviously writing about I'm happy to provide information. You can have your listeners find ways, if you're interested, to reach me to answer questions, because this is something that I just think the public has to be made aware of. They're confused. Many of my colleagues are unsure. Some are skeptical. This is certainly real hard science. But again, I have cautioned a number of times in this podcast, no one should suppose it's a precise science today. Just like an X-ray is not always precise despite what the public thinks. We can presume what might be pneumonia could also be a cancer. We can make inferences based upon shadows on imaging studies. Well, we use genetic testing as a way to help us point ourselves in a direction, but it never replaces a good family history, a clinical evaluation face-to-face, and a history of that patient, what their family background, what their life experiences are, and good psychotherapy.
That is very true. Dr. Pallay, on behalf of myself, my listeners, and all of the people that you've helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the field of pharmacogenetic testing.
Thank you very much, Bridget. It's been very, very exciting to me to share this with you. It's a really developing part of medical care and mental health. And I believe in the future, it'll be more available, more known by our patients, providers. And I think that it's going to be a key piece in the puzzle of handling mental health patients in the years to come. Thank you.
And thank you. So be sure to check out my website, therapyshow.com, which has many resources about mental health, including a whole page dedicated to Dr. Pallay's work and pharmacogenetic testing. There you will also find how to submit questions, stories, or insights you have about the mental health system, or suggestions about who else I can interview and how I can improve the show. I would like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world can gain more benefit from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.